Bismillah ar-Rahman ar-Rahim. I'm Dr. Nizamuddin Uthmani and I welcome you to another video, and that is cephalosporin. Cephalosporin is another very important drugs. In this lecture we will cover their different types, their clinical uses, their adverse effect, and their mechanism of action and mechanism of resistance, of course. Cephalosporin, they are basically derived from another fungus, what we call as the Cephalosporium acromanium. The penicillin was derived from Penicillium notatum, and nowadays the penicillin is synthesized from Penicillium chrysogenum, while cephalosporin they are derived from the Cephalosporium acromanium. They can be used orally, they can be used parenterally, and now a lot of other cephalosporin they are available, which are synthesized by the semi-synthetic methods. This is the structure of the cephalosporin, and they are sharing the same structure with the penicillin. They have the beta-lactam ring, the penicillin have the beta-lactam ring, and with this beta-lactam ring, the different ions they get attached, and thus we can make a large range of cephalosporin if we just change this R position and we add different amino acid, different ions at this level. We can make a number of synthetic or semi-synthetic cephalosporin. What are the properties which make it different from the penicillin? They have got broad spectrum activity, they are water soluble, they are relatively stable at pH and temperature changes, and they have got a very good spectrum of activities. There are 5 generations of cephalosporin. This is the classification, and we call it as the generation. So there are 5 generations. The first generation, they are more active against the gram-positive. The second generation, they are least active against, they are also active against the gram-positive, but not as much active as the first generation. The second generation are also active against the gram-negative, but they are not that much active as that of the third generation. So the first generation, it is basically active against the gram-positive. And we have 3 important drugs in this group. One is the cefalexin, the cefadroxil, and cefadroxil. All of them are oral, and all of them they are available in the market. The rest, the cefazolin, cephalosporin, and cephalosporin, these are also the 3 drugs which are available in the parenteral form, but they are not used routinely in the clinical uses. They are very good against the gram-positive. They are very good against the Klebsiella, pneumonia, Proteus, and we are using the beautiful drug, the Valocept, the Cephrodine, the Duracef, and the Keflex, the Cefalexin. All these drugs, they are used for the upper respiratory, for the lower respiratory, for the skin, soft tissue, urinary infection, which are caused by the gram-positive microorganism. The second group is the second, which is what we call as the second generation. We have 2 oral drugs. One is the Cefaclor, and the other one is the cefuroxime exetel. These 2 drugs, they are available, and we are using these two drugs, while the parenteral preparation like the cefamandole, cefanosate, and cefoxetine, they are not available. So the second generation, you can say they are active against the gram-positive, but not that much effective as that of the first generation. They are also active against the gram-negative, but not that much effective as that of the third generation. Okay. So the third one is these are the 2 drugs. One is the Zenacep, the cefuroxime, and the other one the Cefaclor, which is the Cefaclor. This Zenacep cefuroxime is a very beautiful drug. It is used for the genitourinary infection. It has got higher concentration in the bile salt, and we can use it for the biliary colic, and we can use it for the acute cholecystitis or for the biliary infection. Then the third generation, we have very good drugs. You can say that most of the drugs what we are using nowadays, these come from the third generation. In oral drug, we have 2 very important drugs. One is the cefixime, and the other one is the cefotaxime proxetil. The third one, the cefdinor, is not that much important. But the cefixime and cefotaxime, these 2 drugs are very beautiful drugs. While parenteral, all these 4 drugs are very important. Cefotaxime, ceftriaxone, ceftazidime, and cefaperazone. All these drugs, they are very important. They have got excellent activity against all the gram-negative microbes. They are even active against the gram-positive as well. They are very good drug for the meningitis, especially the cefotaxime and ceftriaxone, because they have got excellent blood-brain barrier access. They are also very active against the pseudomonas, especially the ceftazidime, and they can be used for a number of infection. In case of the cephalosporin, if you combine the cephalosporin with the sulbactam, you can use it for a number of diseases. So they are highly augmented activity they have got against the gram-negative. They are resistant to the beta-lactamase. They are active against the MSSA, methicillin sensitive strain of Staphylococcus aureus. Ceftazidime is active against the pseudomonas, and so we can use the other drugs. These are the preparation: cefodoxime, Orilox, cefexime, Cefspan. Fortum, which is ceftazidime, which is active against the pseudomonas, and ceftriaxone, such a beautiful drugs for a number of infections, including the meningitis, enteric fever, pneumonia, genitourinary infection, for the gonorrhea, so many other diseases. Again, cefodoxime, it has got a bit short plasma half-life, but we are using for the same indication for which we are using the ceftriaxone. And this cephalosporin and sulbactam combination, it's become so excellent that you can use for any sort of infection, for any bugs which are sensitive to the cephalosporin. And the fourth group is the fourth generation, in which we have one drug. The cefifime is the most important one. The cefirome and the cefazolin, these are the two other drugs, but the cefifime is the only drug which is available in the market, and it's a very good drug against the gram-negative. It's a very good drug even against the MRSA, the MSSA, and it's a very good drug even against some positive bugs as well. So we are using the cefifime in deep-seated infection and the peritoneal infection, the genitourinary type of infection, post-surgical infection, and also in case of the MRSA and the MSSA. And the fifth generation, we have the ceftobiprole, which is given orally as well, and ceftaroline. These are the two drugs, but these are pro-drugs. They get activated in the body. These are some, you can say, these are not openly available in the market, and you can use these drugs orally for the gonococci. We can use it for the MRSA as well. So coming to the summary of all the cephalosporin, these are the important drugs. In the first generation with the cefadroxil, the cefalexin, and the cefradin, these three are important. In the second generation, we have the cefaclor, cefuroxime, these two are important. Cefamandole is also not that much important. While in third generation, we have the cefexime and cefodoxime oral drugs, while the cefodoxime, ceftriaxone, cefaperazone, and ceftazidime, these four are the parental drugs which are really important. In fourth generation, we have only one drug, that is the cefifime, which is very important. And in the fifth generation, we have ceftobiprole and ceftaroline. These are two important drugs in the fifth generation. Pharmacokinetics of these drugs, they can be given orally, like cefexime, cefodoxime. They are given parenterally. IV for the ceftriaxone, cefodoxime, ceftazidime, they can be given parenterally. They have got extensive distribution in the body fluid, including in the CSF, in the joint fluid, body fluid, so you can use it for any infection. They are usually eliminated unchanged in urine. Probenecid, like penicillin, probenecid also decrease its excretion. And ceftriaxone is mainly excreted through the biliary tree. So you can say for the biliary infection, ceftriaxone is the drug of choice in case of injectable, while this cefuroxime is another choice if you want to give the oral cephalosporin. The plasma half-life is 1 to 4 hours. And the mechanism of action is same like that of the penicillin. It's just block that the transpeptidation process of the peptidoglycan, and just stop that bridging between the two peptidoglycan layers. It makes the cell wall very fragile. There is fluid movement inside the cell. There is leakage of the intracellular material. There is swelling of the cell, and finally burst out, and the bacteria, they usually die. This is the mechanism. You can read from the book, and you can even stop this video and read this whole slide in detail. Again, this is the stepwise mechanism. The cephalosporin, they block the transpeptidase, and they inhibit the cross-linking, the cross-bridging of the peptidoglycan, and thus there is permeability increased of the cell, and thus there is cell explode in lysis, and there is death of the microorganism. Indication: they are used for the respiratory tract, upper, lower, UTI, enteric fever, infection of the gut, biliary, meningitis, gonorrhea, infected burn, septicemia, aspiration pneumonia, tonsillitis, boil, and they are used for a number of diseases. You just name the disease, and you can say we can use this drug. This is Pseudomonas pneumonia, which occur in the bronchiectasis, and we use the ceftazidime for the Pseudomonas pneumonia. Again, this is meningitis, we can use the cefodoxime and ceftriaxone. Acute cholecystitis, we can use ceftriaxone because it has got higher concentration in the biliary fluid, and we can use oral cefuroxime. Contraindication, it's almost same as that of the penicillin. Those people who are allergic to penicillin, those people who are allergic to cephalosporin, we usually don't give these drugs. Those people who have developed anaphylactic reaction, those people who have developed the Steven-Johnson reaction, we usually don't give these drugs. The other are relative contraindication, right? Renal failure, we can give, like an hepatic impairment, we can give, anaerobic infection, we can give. We can also give these drugs in pregnancy. Ceftriaxone, you can give in the second, third trimester. Cefexime, which is an oral third generation, we can give in the first trimester, even in the second trimester and third trimester. Some other adverse effect like Steven-Johnson, serum sickness, urticaria, rash, hemolytic anemia, nausea, vomiting, and so many other. But remember, two things are very important. Number one, anaphylactic reaction. The second one is the Steven-Johnson syndrome. These two are the most important adverse effect, and it can occur in any person. So you must give the test dose before giving this drug. These are some adverse effect, which is a long list. You can stop this video and you can read it one by one, but these are not significant adverse effect, and they are rarely reported one. Resistance, again resistance like penicillin, जिस तरह penicillin को resistance develop हो जाती है, similar resistance also develop to the cephalosporin. If there is genetic changes and that beta-lactam as enzyme, the cephalosporin as enzyme, there may be resistant. There may be decreased permeability to the drugs. There may be changing of the enzymes inside the cell, which make affinity low for the cephalosporin, and thus cephalosporin can develop resistance. What are the similarity between the penicillin and the cephalosporin? Both have got almost the same structure. Both have got the same mechanism of action. Both are derived from the fungus, and both have got the same mechanism. This similarity, cephalosporin, they are more resistant to the beta-lactamase. They have got broad spectrum, and the precursor may be different in case of both these drugs. Why cephalosporin should be preferred? Because they are broad spectrum, their increased stability to beta-lactamase, they are available in the oral and parenteral form, they are widely accepted, it can be used for the day-to-day infection, and they have got highest safety profile. So this is the summary of the cephalosporin. First generation, cefadroxil, cefalexin, cefredin. Second generation, Cefaclor, cefuroxime, cefamandole. Third generation, cefexime, cefadroxime, ceftriaxone, ceftazidime, and cefaferozone. And fourth generation is the cefifime, and the fifth generation is ceftriaxone. They all are the cell wall inhibitor. They have a better CSF access, especially for the ceftriaxone and for the cefuroxime. They have excellent concentration in the bile acid, especially the ceftriaxone and the cefuroxime. Safe in pregnancy, good against the MRSA. They have got a very good activity against the pseudomonas like ceftazidime. And for the MRSA, we use the cefifime, the fourth generation. And they have acceptable adverse effect, except the Steven-Johnson reaction and the anaphylaxis. Baki jo iske adverse that is acceptable. With this, I came to the end of another lecture. Don't forget to subscribe this channel at the name of Dr. Nizamuddin Uthmani, and watch this video, share with your friend, and thank you very much. God bless you.